In our course descriptions, we said we would include case management in this particular module, and we know that won't be of interest to everybody or even be possible for everybody to understand or be able to utilize this particular knowledge, but we did want to include it. So let's start by talking about what case management actually is. It's a term that we use basically in social services, particularly with social workers, as a way of basically describing the job of a person who sort of ensures that all of the various moving parts of a person's care are working together and stay involved and stay in the loop. And it starts with tracking, really keeping a record of how that individual is doing. Now, if we're not paid to do that, then it's not terribly realistic for us to do a lot of tracking, but we are going to give you some ideas that will give us a bit of a substitute in a moment. Coordination. This means basically making sure, as we said, that all the moving parts are talking to each other, that they're working effectively together. And again, that can be difficult from a layperson's perspective or from the side of our desk. So we're not going to suggest that you do it exactly the way that a social worker would, but we're going to give you some ideas. Record keeping and collation. So keeping all of the various records that an individual will accrue over the course of their treatment from all the different professionals, and even if they're in a care home or something like that, the records that are kept as a part of their stay in that home. And not only making sure that they are kept, but they are kept in an orderly fashion so that people can go back and utilize them. And of course, making sure that they're all kept for privacy in a secure way. Also making sure that people keep their appointments. And some of the times the appointments individuals are keeping are not just for diagnostic reasons or checking in, but also because they may be getting an injection of a medication, and without that injection or without that refurbishing of their prescription, they may not maintain good mental health. And the case manager may have a role of referring people to other care or to helping navigate them to other care. And again, this is beyond the capacity of most of the people who'd be taking this course, but we're going to give you some ideas on how to approximate it. So here's a lay approach to case management. First of all, we can work with an individual just to make sure that they maintain for themselves a secure and singular storage area for their records. And what we would recommend is that you would have that person keep their records as possible, if possible, in really a two-leveled system. The one is a binder where everything that's from the last year is essentially maintained. And this would include things like their medication prescriptions, any kind of medical reports from the last year. If they have a face sheet, as discussed way back in an earlier module, there would be a copy of that there. Just basically something that if they were going and encountering a new doctor or a new clinical person, such as a psychologist, they could actually take this with them. But they should also have a second place, for example, a file box where they keep all of the stuff that is beyond a year old. And it would be great if they kept all this stuff in one place, and if they had a firebox or something like that, if you're in a position, if it's a family member of yours, for example, then that's something we want to maintain. Because one of the most difficult things for an individual is keeping track of their history, and nothing is more precise than the written records. Tracking simply means keeping track of or recording an individual's progress day to day. And that's something that would be done by staff people if an individual is in a care facility. But if an individual isn't in a care facility, it doesn't happen. And really we would like to be able to have some approximation of this. If an individual is in the care of their family, for example, they're a youth or they're a senior citizen, support people, their family can actually keep these records, and it's not necessarily terribly onerous. They can simply go and literally buy a simple notebook and make a point at the end of every day or partway through the day and at the end of every day, writing a simple tracking note about how things have gone. Now, I've said here that they need to use a concrete method. And what we mean by that is it's not useful if you have, say, 4 or 5 people recording to have somebody indicating the mood of the individual, because every person's interpretation of a mood will be slightly different. When we talk about writing in a concrete or behavioral style, what we're doing is describing what people did. And that is very objective, and individuals who will read that record later on can see for themselves that that data is neutral, and they can therefore draw their own conclusions from it. And that's true of course, of a clinician as well as even a family, again, sitting down and looking over a period of time at what everybody has written. And we've gone back in Module 3 and talked more about this, so if you haven't taken Module 3, there's information more there about how to correctly record. But what we simply want to achieve here is that we don't just have the outside observers of a person writing down their impressions of how they were. we would much more interested in having somebody write down what they actually observed a person doing or not doing and how it was different or significant compared to the previous days. On the other side of the equation, we can actually get consumers to track themselves. So even if a person is living completely independently, we can have them track themselves. And particularly this is valuable when an individual has a mood or cyclic disorder, a bipolar disorder or mood disorder, because it's important for their doctor to know whether the medications are working or failing. And because we're asking the individual to rate themselves, we can go with a simpler approach, which is simply giving somebody a scale. And we have to individualize this to the particular individual, but we can give them a numerical scale where we can, for example, say a +3 equals an extremely happy day, a 0 equals a neutral day, and a -3 equals a very low day, and everywhere in between. And an individual can track at specific times every day, for example, at wake up, at lunchtime, dinner, and bedtime. And what that will allow the individual to do, or others who are working with them, is to truly graph that individual's moods and see whether or not they are trending toward improvement, whether or not the moods are changing and flexible as we would expect in a normal day-to-day experience of the average person, or whether or not they're trending towards something that is indicating that medications and other interventions aren't working. We should also have either the family members or the individual themselves writing down any behavior of note, and this could be behavior that represents progress or behavior that represents a regression. So it could be, for example, that an individual spent less time in bed in a particular day, or that an individual went out to Clubhouse on a particular day, or that an individual went and signed up for a play pass at the leisure center, or that the individual spoke on the phone to somebody in a social manner. All of those would be signs of positive change. But we also, of course, need to keep record of any crisis that the person has gone through. So they could be recording thoughts or feelings if it's the individual recording for themselves. And if it's observers, we can record behavior that we see that might indicate that, for example, a person is getting more depressed or suicidal, or perhaps they're behaving in a way that is frightening or aggressive to others. And a really simple thing to do is just to get people to write a diary or journal every day. And diaries and journals aren't identical, but they can be merged into one thing. And the reason why this is a good idea is that it's both therapeutic and it has the effect of being a good record as well. So a diary literally is a record of what a person has done in a given day. And they can describe the amount of time that they spent sleeping, or the amount of time that they went out, or the amount of time they went to work, or they can describe the interactions they have with other people, and all that information is useful. A journal is more of a description of what a person's thinking and feeling, what their mental processes have been, and this is part of the reason why it can be very therapeutic, because as people write out and explore their mental processes, they can sometimes start to think about their thinking. They can be metacognitive, as we call it. And that's a very useful tool, particularly for people going through things like drug and alcohol recovery. And so we can combine both of these things together and have a person keeping a record that they feel comfortable either bringing to a clinical professional, or at least summarizing when they go and see their psychiatrist or their general practitioner. We also can encourage people to be effective in their medication storage and in their tracking. When a person is in care, it's very, very important that their medications are kept secure, that they're kept separate from other people's medications, that they're kept in a place that is warm and dry and not going to lead to the damage of those medicines. And they're always carefully signed for and prepared by the staff people. And this is because the taking of medication can be a very, very helpful thing for an individual with a psychiatric disorder, but the misapplication of medication can be very, very damaging or deleterious. So we want to make sure that we're encouraging individuals to use systems, both for the storage of their medicines and the taking of their medicines. We want people to literally get in the habit of writing them down. If, for example, you're in a position to help a person by having a medication alarm, and this can be simply on a watch, or it can be on their digital phone, or it can be on an actual medication storage container. You can actually go and speak to pharmacists or buy them online and buy containers that literally go off at the time when an individual needs to take their medicine. And they can go to their pharmacist and, as we spoke about in an earlier module, get bubble packs. They can get tracking sheets where they can actually sign for themselves, or even if they have a bubble pack, just initialing or checking off. One of the great things about bubble packs is that you can see right as you push the bubble that you've taken it for that particular time. But some bubble packs, the ones used more in an institutional setting, don't say the exact time on the bubble, so that's where an initial would come in useful. And what I would suggest, if that's the type of bubble packs available available where you're working, is to ask the pharmacist to make the date and the bubble number be the same. So because most bubble packs actually hold up to 35 pills, but we would really like the individual to have 1 pill per day. So if it's a 38-day month, they would only have 30 pills, and in February they'd only have 28 pills. It's also a very important thing to help a person get a planner, and this can be very, very low tech. It can be literally as simple as going to the local insurance office or whoever gives away a free calendar every year and using that. It can even be in a notebook where we go in advance and write the simple date per page and allow people to think about their notebook as a planner. And they can use, again, a phone or a computer if that's what suits them best. And in some cases, people can use a calendar that is on a computer that is visible on a server by others who are in their support circle. So it's a way for people who are working with that individual to see what's coming up or to communicate to that individual. And I really encourage you to explore some of the mechanisms that are available out there, many of them for free if they're already embedded in, for example, your Microsoft Outlook program that you may have on your PC, or, for example, a website such as Doodle, D-O-O-D-L-E, which really is an effective, totally simple and free approach to having people schedule appointments together, and it's a way of connecting with individuals and finding out when's a good time to get together very simply. So we really want to look at all the various options, and what I love is that there is a way to combine the planner and the journal for an individual. So as much as possible, if we can make things simple and concise, that's going to be helpful as well. But a planner is a part of a person's individual care plan, and I really strongly encourage us to use them and to encourage people to build looking at and writing in their planner into their day every day. So they should go to bed at night making sure that they have written into their planner and checked it, and wake up in the morning making sure that they are checking their planner as well. And a planner has another possible use, and that is that it can be used as a communication book. And I haven't got this on the slide, so I apologize for that. But when an individual is going from one service to another service, or from one service back to their family home, it can be really useful for there to be a written mechanism that allows people in each home to describe things that may be important for the others to know. And it could be something as simple as John will need his bathing suit on Friday because we're going out swimming, or something as important or critical as John is out of medication at this location, or John is starting to become quite upset with somebody here at this location and he may want to talk to somebody at home about this. So those sorts of things can be communicated concisely. It's not the same as a tracking journal, and sometimes people get confused about this. And of course we do need to very much be aware of people's confidentiality rights here, and we have to make sure that anything we're doing like this, A, involves them, and B, is okay with them. So I really like the idea of having the individual write in their own communication book, and then we know for a fact that the individual is comfortable with what's been written. They're more mindful and aware of what's going on. They're more invested in their own care, and when the message gets home, they are more likely to convey it because they know that it was written there. And we talked about referrals as a job of the case manager. Well, as a family member, we are not going to be in the business of being able to refer people. However, we can connect people with those who are in that position, including social workers. Often, however, people are either intimidated or unsure, or both, as they approach other professionals. And it can be a very simple but vital thing for us to go with a person, either assisting them in the setting up of that appointment, or of planning their bus route, or working through their schedule so they know what time they need to get up, or setting out their clothing, or even accompanying the person to appointments if possible. We need to have a dialogue with the individual and find out, do you want me to go with you and drop you off at the front door and come back? Do you want me to walk you through that particular building until we find the office and sit in the waiting room for you? And in some cases, the person may actually want you to go in with them and be there with the clinician. And so it's important for us to have that conversation as well. Now, one of the last things we want to talk about is, in a normal case management approach, we would sit down as a team or cohort with support people for an individual annually and try to see how things are going. Now, that can be difficult to amass when we don't have paid professionals around. But I would really encourage you, if possible, to get together on an annual basis, as some fashion at least, as with whomever is possibly available, to have this discussion. And for those people who can't come, they can contribute their portion, perhaps through a conference call or through a written component. And I really say that this is something where we're celebrating a person's progress as well as planning for the next year and evaluating what's worked well. And there's no reason why this can't look like a party or a barbecue or a picnic or a meeting in a coffee shop, whatever is going to work for that individual. And nowadays we have the technology to be able to do it quickly and cheaply to our computers or even to our cell phones. So whatever is going to work is what we want to do here, but we want to not just be flying by the seat of our pants. If possible, we want to have sort of an annual investigation of what's going well, what can we work on, and what are the goals for that individual. And that is the key portion of the case management approach, that we really want to have that individual at the core, describing what their goals are, what they think is working, and what approaches they're interested in. Sometimes we sit down and we have this perspective that we want to have 4, 5, 6 lofty goals for a person, but they really only want 1 or 2 small or simpler things because that's what they feel they can take on. And we really want to be reminded that if the individual doesn't feel comfortable with what we're planning, then nothing is going to happen. So we really need to make sure that we are putting that individual front and center anytime we're going through any kind of case planning or case management approaches. So hopefully that gives you some ideas, even if you're not a paid professional, for how to do some coordination or management around an individual. And it does really rely on us coordinating and connecting with others, other non-paid people and paid people who are working with that individual. And it again requires us to think beyond our job descriptions, think in a way that's innovative, but in the end will probably mean that we are engaging with people in a way that's more efficient and effective, and probably will make everybody feel a whole lot better. Thank you.